Hi, my name is Deanna Peartree. I am a licensed insurance agent here at Simco HR. We are going through our Medicare educational presentation, or what we call our Medicare 101. In the presentation, we'll cover like enrolling in the timelines. We'll cover the major parts, A, B, C, and D. And we will also go through then the options once you're enrolled in Medicare, along with the different enrollment periods. Okay, so let's just get started. Okay, so basically, Medicare is the federal health insurance program. So we always like to make sure we distinguish between the health insurance and the retirement benefits, right? Because Social Security administers both the insurance, Medicare, federal health insurance, and the retirement benefits, which is the money. Two different timelines, two different things, some overlap, but we like to make sure you understand that we are just specifically going through Medicare. That's the health insurance program. It is funded in part by your taxes while you've been working, and it's for those who age in. You're turning 65. Certain disabilities, once you have met the 24 months of Social Security disability benefits, you will automatically enroll into Medicare. And then some people with end-stage renal disease or ALS. So for those who are collecting Social Security already, your enrollment will be automatic. You will automatically receive your card in the mail from Social Security. It'll have both parts A and B on it, and it roughly 3 to 4 months prior to your birth month. And for those who are on disability, so if you're on Social Security disability, the 25th month, you will receive your Medicare card. However, if you are not collecting Social Security yet, then you actively have to enroll. Roughly 100 days before your birth month or 3 months out, and you can enroll in 3 different ways. You can call Social Security and schedule an appointment that they'll do virtually, or an appointment in person if your Social Security Administration building is open for in-person appointments, or if you are able and you're maybe a little more tech savvy, going on to ssa.gov. So if you've already looked up your Social Security benefits and you have an account, it's going to be in the same place. You can enroll in Medicare through that online portal. This is what the card looks like, right? It's the red, white, and blue card. It's going to have an alphanumeric number on it that's more encrypted. It used to be your Social Security number. It's no longer that. And then it'll have part A and part B, and it'll have the effective date. So if you are newly aging in, it's going to be your birth month and then the year. We like to go through the Medicare governance, or the organizations that you're going to want to make sure you pay attention to the mailings that you get from these organizations. One is Social Security Administration, right? Because they process your application to Medicare, and then they also process the Part B billing, which we'll talk about more throughout the presentation. Then also CMS, or the Centers for Medicare and Medicaid Services. They are an organization under the Department of Health and Human Services. So you'll get mailings from CMS. It'll typically say Department of Health and Human Services and then CMS under it, or the logos will be on the mailings. So these 3 logos, these 3 organizations are the ones you want to make sure you pay attention to those mailings, right? That's the one you're going to want to open up. Also, we have a number of people who accidentally throw out their Medicare card because it comes pretty nondescript, and that's on purpose. But it'll come from CMS, and it is just a heavier paper stock. So if you get mailings from one of these 3 organizations, be sure to open it up. Don't throw it away until you know that you no longer need it. I always say have a folder, keep it all there, so that you have the materials. Okay, so there are a lot of enrollment periods involved with Medicare, and it gets a little bit confusing. So we are going to go through the first two, initial enrollment period and the general enrollment period first, because they pertain to newly getting into Medicare. So the initial enrollment period, right? That's when you first turn 65, newly eligible. It's the 7-month window around your birth month. So if your birthday is February 15th, then February 1st is going to be the effective date. And you have 3 months prior to enroll, and the effective date will be February 1st. You also have the 3 months after, right? Your 7-month window revolves around your birth month. So if you enroll in one of the 3 months after, the effective date will just be the month following. So in this case, it would be up till May. So you could enroll in May and it would be effective in June. It used to be a longer effective date, and they've removed that effective this year, 2023, so that there is no longer a possibility of a late enrollment penalty because of any kind of delays. And then if you are newly going into Medicare because of you're on Social Security retirement benefits, your initial enrollment period will be that 25th month. So once you have been on Social Security disability for 24 months, your Medicare effective date will be that 25th month of benefit disability benefits, and it will be an automatic enrollment for you. Okay, then the other enrollment period that we want to talk about as it pertains to newly getting into Medicare is the general enrollment period. So if you do miss your enrollment period, you have then the following January 1st to March 31st to get enrolled. And this is for anybody who missed their IEP or your initial enrollment period. Then the effective date will be the month after. So if you enroll on January 1st, it will be effective for February 1st, the month after. Again, this is new this year. The effective dates used to be pushed out, and in 2023, they have removed those so that there is no longer a gap possibly in coverage. Okay, so the major parts of Medicare. So we have Part A, which is hospitalization, and Part B, which is the medical. Together, that's your red, white, and blue card. That's also what's known as original or traditional Medicare. And then we have Part D, which is the prescription drug piece, and Part C, which is the Medicare Advantage. So let's dive into it a little bit more. First, let's talk about the costs that are going to be associated with your Medicare. It should be very similar to what you would have either through the employer or in the individual market. You're going to have premiums, which is the fixed amount that you pay monthly. There is a deductible, there are deductibles, and that isn't the amount you pay before benefits or services in the plan. And then copays are fixed amounts for the services, and coinsurance is a percentage. So you'll have coinsurance where you're responsible for a percentage, and then the plan picks up a percentage. Part A. So the list of covered services under Part A are inpatient hospitalization, skilled nursing facility, hospice care, and home health care. Inpatient meaning you're overnight in the hospital, an overnight stay inpatient in the hospital. Skilled nursing facility, that is rehabilitative, that is not nursing home, right? This is after an inpatient hospitalization, you might need to go to a skilled nursing facility rehabilitatively until you get back on your feet. So these are like the bigger cost pieces of health insurance. So we'll go into some of the costs associated with Part A, but most people don't have a premium, so sometimes called premium free. as long as you or your spouse have paid Medicare taxes for up to 40 quarters or 10 years, then it would be premium free. Part A has a deductible, copays, and other costs. We'll go through that. It is nationwide coverage. So any provider or facility that is assigned with or takes Medicare is going to take your Part A and Part B. Late enrollment penalties are assessed if you don't pick it up when you're first eligible and you have a premium for Part B, for Part A. Okay, so the cost with Part A. So for most people, there is no premium. The deductible is $1,600. That is for this year. These numbers do change every year. So it's per benefit period, your hospital deductible. And then after that 60-day, and the benefit period is a 60-day window initiated by if you are admitted into the hospital. So the first 60 days, there's no copay, it's just the deductible. And then on day 61, you have a $400 per day copay. And that's for days 61 to 90. And again, it's a 60-day benefit period. So there is a possibility of having more than one in 1 year. The next is the skilled nursing facility. So your first 20 days are covered at no cost. Again, rehabilitative skilled nursing facility. And then it's $200 a day for days 21 to 100. And the big thing to note here, right, is that there's no out-of-pocket limit, and that's kind of scary. So that's why we talk about options to add to your Part A and B, but also with the understanding that your Part A and Part B are a base point, right? This is going to be the foundation where you start, and then you'll want to make sure you protect yourself and add something in addition to. Okay, so Part B has a list of services as well. This is going to be anything than outpatient, right? So your preventive services, your doctor visits, whether that's primary care or a specialist, outpatient services at the hospital or an outpatient service at some kind of surgical center, home health care, durable medical equipment, right? So that's maybe crutches or wheelchairs, things like that. Again, yes, and your preventive services. There is a monthly premium. We'll cover that. And deductibles, coinsurance. Again, it's the coverage is nationwide, and any provider or facility that is going to take or is assigned with Medicare is going to take your Part A and Part B. There are late enrollment penalties if you don't sign up when you're first eligible. In most cases, this is where when people talk about they've got a late enrollment penalty, this might be one of them. And we'll talk about a little bit more. So Part B, again, these costs also change every year. 2023, our costs actually have gone down. So the premium this year, standard premium is $164.90. It's income-based, so you may have a higher premium, and we'll cover that in the next slide. The deductible is annual, and it's $226 this year. After the deductible, you have a 20% coinsurance. So you're responsible for 20, and the plan picks up the 80. And that's for any Medicare-approved services. There also might be excess charges. So you would be $226, you're 20%, and then if there's excess charges, you would be responsible for that. And again, the big thing here is to note that there's no out-of-pocket limit, and that can be very scary. So this is the schedule for the Part B premium. Note that it is the modified adjusted gross income, and it's also looking at filed taxes 2 years ago. So it's always going to look back 2 years. If you're in 2023, it's going to look at your income taxes filed in 2021 to know where you are in the schedule. So if you're individual you file taxes individually and you're $97,000 or less, you're going to be in that standard rate of $164.90. If you are married filing joint and your taxes were $194,000 or less, again, in that $164.90. Same as if you are married and filing separate, it's that $97,000 also. So note that if your income is more, you have a higher premium for your Part B. They call this the income-related monthly adjustment amount, or in the market, a lot of times people call it IRMA. So if you have some IRMA assessed on your Part B, note that you will also have IRMA, or income-related monthly adjustment amount, on your Part D once you get Part D. And we'll talk about Part D a little bit further in our presentation, but just note that if you have it on Part B, you also have a smaller amount of IRMA on Part D. So Part D, it's different because it's not on that federal health insurance program card, right? Your A and B is covered on your Medicare, what you get from the government. The difference here is your drug coverage, you are going to have to get through a Medicare approved insurance company. And that's through either a standalone drug plan or one that's inside an Advantage plan. So the drug coverage is going to help you cover the cost of your prescriptions. There are late enrollment penalties assessed on Part D. More often than not, when we hear people talk about late enrollment penalties, this is where we see it. And that's because at the time that they were eligible, they didn't pick up drug coverage. But we're going to try to make sure you don't have that, right? The problem with the late enrollment penalties, it's not a one-time fee. The late enrollment penalty is a fee that will last you the rest of your life. So while it may not be, that much accumulated, it could be pretty significant. And if you stay on employer coverage, know that you must have credible coverage. And again, we will cover that a little bit more. The drug plan comes in different stages. So this is a CMS, Centers for Medicare and Medicaid Services, design. They set it up so that all drug plans that you're going to get, whether it's through an Advantage plan or a standalone, are going to have these stages. If your plan has a deductible, the deductible will have to be met first. Most times that deductible only applies to higher tiered or more expensive drugs like brand and specialty drugs. And then you fall down into the initial coverage. If you don't have a deductible that you have to worry about, you would just be in the initial coverage. In the initial coverage, you are going to be paying your cost sharing, right? The copay assigned to that tier of drug. Then you can meet a threshold and go into what they call the gap or the donut hole. And then you meet another threshold and you could get into catastrophic. So let's just take a look at what those limits are. So if your plan has a deductible, the highest it could be is $505. That is set by CMS. A number of the plans have anywhere from 0 to 505, right? So it could be somewhere in between that. And if you have higher cost drugs, this is something that you're going to want to make sure you understand. So once you meet that 505, then you would go into the initial coverage. So in the initial coverage, you are paying the assigned copay or co-insurance that is based on the tiered drug. So if your tier 2 drug is a $10 copay, that's what you would be paying. Once your out-of-pocket costs plus what the insurance company has paid reaches $4,606. You've met the first threshold for the initial coverage, and you would then go into the donut hole or the coverage gap. Inside the donut hole, you are going to be paying 25% of the cost of your drugs until you meet what's called TROOP, or the true out-of-pocket costs. And that threshold number is $7,400. So to get out of the initial coverage, right? That initial coverage, $4,660, they're adding up what you paid and what the insurance company paid. So if you do have some higher cost drugs, you could reach this pretty quickly, or at least within the first 6 months or something of the plan. And then you would get into the donut hole. The donut hole threshold, that 7,400, is then just accumulating or adding up your costs. So the deductible you've paid, any co-pays or co-insurance that you've paid, until you get that 7,400. Right? So the thresholds are equated differently to get to those different amounts. And then if you do get into the donut hole and get the 7,400, you go into what's called the catastrophic stage. And in there, you'll be paying 5% coinsurance, or $415 for generics and $1035 for all others. And you'll remain in that stage for the remainder of the year. So there's no cap. You'll be paying lower costs for your prescriptions, and you'll stay there throughout the year. Again, we tell people who have maybe a number of prescriptions, or if they have prescriptions that are in some of the higher tiers because the cost of those drugs are higher, you might move through these stages. Most people stay right in the initial coverage where they're just paying their copays and they never reach that first 4,660. This is something that we will sit and do an analysis with you. We can compare plans and make sure that your drug coverage is going to be the best fit for what you have. So there are programs to help with prescription drug coverage. There is a federal program called Extra Help, or Low Income Subsidy. It is a Social Security, it is run through Social Security. It's income-based. It does do an income and asset test, so it's going to test for both of those to see if you would qualify for that. Then there is a New York State program. It's called EPIC. It's the Elderly Pharmaceutical Insurance Program, and it is also income-based. The threshold is higher, and EPIC has two different programs: fee-based if you have a lower income, and then the deductible base if you have income that's in the higher income base. The nice thing about EPIC, one, the deductible plan has no cost to it. The other is that EPIC gives you one special election period every year that could allow you to make a change if you need. So let's say you get 6 months into the plan that you're on, and all of a sudden you have a new medical need, or your prescription drugs change, and you find a plan that's going to fit better for whatever might be new for you. If you have EPIC, we can use EPIC as the special election period reason to make a change for you. So we do try to make sure everyone understands that and gets enrolled in EPIC so that you just have it. It's a safety net for you. So there is also another assistance program called the Medicare Savings Program. This can help you pay for that Part B premium. It's income-based, and it may also help you with some of the other cost sharing, some assistance there. It is income-based, and we do, try to help people get enrolled in the Medicare Savings Program if you are eligible. So what are my options? So the options in the market are to stay on the employer group health plan if you are already, choose to go on original Medicare, add a supplement plan, a Medicare supplement plan, or add the Part C, the Medicare Advantage plan. So let's just walk through each one of these options. So if you are on employer coverage already, and you want to know whether or not you can stay on that employer coverage, there are a number of considerations. First is the company size. Do you have less than 20 employees, or do you have more than 20 employees? So if you have more than 20 employees, you do have the option to delay Part B. We only list Part B because there's a premium to Part B. It's, a lot of people will go on Part A and just have it while they're on employer coverage because there's no cost to it. But they'll want to delay Part B because there is that premium associated with Part B. If the company size is less than 20, you don't want to delay Part B because in that situation, Medicare is deemed to be primary payer. So if your company has less than 20 employees, you need to get on Part B, otherwise you will be paying the cost of what Part B should be covering. Right, so Part B is going to be deemed primary, so you'll want to make sure that you get it. Also, you'll have a late enrollment penalty if your company size is less than 20 and you didn't get on Part B, because that's when you were first eligible and you should have been taking Part B. You can stay on your company, your employer group plan if you have A and B. Just note that you have to pay for B, and then whatever costs that might be associated for your cost share on the employer health plan. So if you are already collecting Social Security benefits, you're going to get your card A and B automatically. So there's no delay to the Part A, but you have the option to delay. The big consideration with Part A is if you're on an employer plan and it is a high deductible health plan and you are making contributions to an HSA, you will want to make sure that you don't take A or B. So if you're collecting Social Security retirement benefits, right, and you decide you get the card automatically, you're going to want to send it back and delay both parts A and B if you are contributing to an HSA. And the reason being is that if you have a high deductible health plan and you're contributing to an HSA, Part A, you cannot have any other insurance, right? And the IRS does govern those HSAs. So if you are on a high deductible health plan with an HSA making contributions and your card comes for A and B, you're going to want to send it back and delay it if you're staying on the employer coverage, because Part A would be considered other coverage, and there is a penalty assessed on your taxes if you had both Part A and you're contributing to an HSA. So you're going to want to delay that. Also know that when you go to get off of the employer coverage and you're contributing to an HSA, you will want to give yourself a 6-month window of not contributing to your HSA when you go to get on that A and B. And that's because there is or can be retroactive enrollment into Part A through Social Security. So if you're in this situation, come in and talk to us. We'll help you design a timeline that would be more specific to what you're going through. Okay, option 2. And that is just staying on original Medicare, right? So you have A and B in place, you have your Medicare card, and you add a prescription drug coverage. This is an option, it is not a recommendation. And that's because we know that with just having Part A and Part B, that there are no out-of-pocket limits. And so there's a great exposure that you could have with just having Part A and Part B. You satisfy any enrollment penalties or anything like that, so you're fine there. It's just a very big exposure, a lot of risk to just having that. So again, this is an option. We have to let you know it's an option, but it's not a recommendation. The other option is, again, you have original Medicare, so you have your A and B card. You add a standalone prescription drug, and in this situation, you might add a Medicare supplement or a Medigap plan to help with the costs, your out-of-pocket costs for A and B. In this option, you have your Medicare card, right, Part A and B, and you get a supplement, it picks up after. Medicare's primary, the supplement is secondary payer. And depending on which supplement you decide to get, it covers A and B differently. In this option, right, you will have the costs for your supplement plan. You'll have the costs for your standalone prescription drug plan, and then you will have your costs for Part B. This option can be a little bit more expensive. The supplement plans that pay more of hospital and more of the medical are a little bit more expensive. So just know that this option, you might be paying more, but you might be paying more upfront for premium. But if you have a lot of medical costs, you might be paying less on the cost sharing part. So in this situation, you must have Parts A and B. The supplement plans are only going to cover the services under A and B, right? So you're not going to get any additional coverage if you're looking for dental, vision, hearing, or out of the over-the-counter benefit. That's not going to be in the supplement, right? They're just going to cover the services under A and B. It does vary by zip code, the cost of it. So the design of what those supplement plans look like, they are also named Plan A, B, C, D, up to K, actually N. So don't get confused, right? There is a Plan A and a Part A. So it's very, you have to be very specific on, whether you're talking about Part A and B, that's original Medicare, or the plans, and they are noted by plan instead of part. So the plans and how they are set up is all designed by CMS, right? So Plan A and Plan G and Plan F, that looks like Plan A, Plan G, Plan F, no matter where you get it. The costs, so the insurance companies can come in and say, okay, we're going to offer A, B, C, D, E, F, G in these regions, and this is what they'll cost. So the insurance company can decide what region they're going to offer and what the cost will be. And these do vary by zip code. And then in addition, you will need to get a prescription drug plan. The other thing to note again is that these are nationwide, so any doctor or facility that takes assignment with Medicare is going to take your supplement plan. So when it's a good fit, if you are looking at some more medical or hospital expenses, this is a good way to budget it, because you'll know exactly what your costs are, or closer to what your costs will be. Your premiums might be higher, but you'll be able to budget your costs a little bit better. It does travel. So if you have 2 homes and you have doctors in 2 different locations, you might, want to plan a supplement plan, because there's no network. The network is whatever the doctor or facility taking Medicare. And then you're assured to keep it. So as long as you can keep making your premiums, you will be able to keep that. Also, there's no referrals, just as long as the doctor takes assignment with Medicare. Then our fourth and last option is, again, you have original Medicare in place, so you have your Part A and B card. And then you get an Advantage plan, which is considered to be Part C. Part C in this option, the Advantage plan, becomes primary payer. It covers the services under A and B. Most will then bundle in the prescription drug, and then all of them do include that dental, vision, hearing, maybe some over-the-counter benefit, and then it sets out-of-pocket limits. So when these are a good fit, or a little bit more information about the Advantage plan. Again, you must have A and B in place. The Advantage plan is going to add in a lot of those extra benefits that you might be looking for coverage. And most of the time you will get that with your prescription drug coverage. We can talk about options why you would, take it without the prescription drug embedded in it. They're run by Medicare approved private insurance companies. So because of that, and because then that's primary, you do have the networks to consider. So you want to make sure that your doctors are in network. Any hospitals, in the region will make sure that those are in network. And also, I always say, let's look at your prescription drugs to know how that plan is going to cover your prescriptions. They set max out of pockets, and it is by plan service area. So if you move out of the service area, you do have to enroll in a plan like it or similar in the new service area. So you do have to pay for your Part B, right? You pay your premium for Part B because you have to keep original Medicare in place, and then the premium that's assigned to the Part C Medicare Advantage plan. So the advantages to taking this path is that most of the time these premiums for the Advantage plans are lower. In most of the areas we have zero premium plans. So they start at zero premium and go up to a couple $100. The difference is going to be the cost sharing inside that plan. For the lower premiums, your cost sharing might be higher, and vice versa on the higher premium plans. They are a good backup to VA benefits if you have VA benefits, if you like the doctors that are in that network. And also then the Medicare Advantage plans do work with the low income subsidy programs, as well as the EPIC program. And then the fact that they have all the additional benefits. Unfortunately, that is the thing where a number of these other agencies have gone to the networks and told people, all your plans must have dental, vision, and hearing. Not true. Most all of them do, but you want to make sure you understand what the added benefits are in that Advantage plan that you're looking at. So we covered the first two enrollment periods, initial enrollment and general enrollment, eons ago, right? Back when we first started this lengthy program. So now we're going to go through the other three. So the initial enrollment is a 7-month window around, when you've aged in, or if you're on disability, the first time that you are eligible, your 25th month. That's a one-time thing. Once you're done with your initial enrollment period, that's it. And then the general enrollment period if you have missed it. So the next ones are the annual enrollment, the MA open enrollment. Again, fixed timeframes because there's a very specific time of the year for those. And then special enrollments, which are more event driven. So the annual enrollment period. So that's from October 15th to December 7th. And that's for anybody who is on Medicare. They can make a change during this period. It will then be effective for January 1st. Oops. Then we have the Medicare Advantage open enrollment. So anyone who has a Medicare Advantage plan can make a change during this time, and that starts January 1st to March 31st. And then the effective date will be the month after. So if you enroll in January 1st, it would be, you could make an effective date for February 1st. These two enrollment periods are available every year. And then we have special enrollment periods. Earlier, when we talked about EPIC, we talked about how that gives you a special enrollment, event-driven. Because you have EPIC, you can then use it as a special enrollment. If you move out of the service area, event-driven, it allows you, or you must make a change. If you've lost your employer coverage, so if you're coming off that employer coverage, you're retiring, that gives you a special enrollment period to get on. Any changes in Medicaid or low-income subsidy, or if you come in and out of an institution, those could also give you special enrollment periods. So that is the conclusion to our Medicare 101 or presentation. We're glad that you joined us today. Here is our information. Please reach out. We would love to give you a hand and help you out with your Medicare needs. Thank you.